P.
I, N, G. All right, what are we? Let's go to 11.
Don't let me win.
All right, deal. What are we talking about today? What are we going over?
We're talking about anything you want. Healthcare, business, life. All right. Oh, he's bringing it out.
I'm coming. 2-1. What about your playing days? Want to talk about that? Oh, twos. Oh! All right, 3-2.
Whoa! That was a good one.
Threes.
We're pretty evenly matched.
I think so. And you don't even do this every day like we do. 4-4?
4-4.
The podcast is meant to celebrate the
4-5.
people that are doing everything they can to improve access to care, experience while getting that care, and then outcomes for our patients. All right, so Chris is a part of, tell us a little bit about Hotchkiss.
Hotchkiss Insurance, family founded, owned by a group of partners now, independent, fiercely independent, largest independent firm in Texas that's not private equity backed or publicly traded. So we've got a big scale. Such a lucky shot.
Right now, healthcare costs are way too high. It reminds me of that clip back in the day. Rent's too high. Well, healthcare's too high, too expensive. And there's companies like Chris here that are challenging the status quo, bringing education and information to the industry that is changing the way we consume healthcare, which we need more of. Game point.
Don't let me win. You can't let me win.
Good game.
Good game, man.
Thank you for being here.
Yeah, I appreciate you having me.
This will be fun.
Yeah, super cool environment you guys
You ready?
Here. Yeah, let's do it.
Let's do it. All right, man. You ready for this?
Let's do it. The question is, everybody else ready for this?
I don't know. I don't know if they are. Cool. Let's rock. What's up, everybody? It's David. I'm your host of Highway to Health Podcast. Appreciate you being here. I love doing these, and I appreciate you supporting me and my guests during these shows. Today, we're going to talk about what we always talk about, improving access, experience, and outcomes for our patient community. There's a lot of different areas that impact those three things, and that's why I'm excited to have the guest on we have today. His name's Chris Hamilton. He's a partner at Hotchkiss Insurance, and we're going to talk about the things that we're all battling with: access to care, the experience, the cost of care, and how Chris are partnering with employers, but also partnering with patients to improve all of those elements. Chris, welcome to Highway to Health. Thank you for being here.
Thanks for having me.
This will be fun. We won't talk about the ping pong match earlier and who came out the winner, because sore subject for me. But we start every podcast the same, and we talk about healthy habits and what you've implemented in your life, maintain mental, physical well-being. It's so important. You've got a family, you've got a business. To perform at a high level, we've got to be healthy. So what do you do? What's a healthy habit you've implemented?
I've always worked out. I think it goes back to playing football as a child. I played Pee Wee through college, and I had a coach when I was in college. I want to say he was in his early 70s. He's a legend here, Sam Shields. If you look him up, he's a legendary coach here in DFW. And I remember having a conversation with him when I was graduating, and I said, "Hey, Coach, what's the secret?" And if you saw Sam Shields, he was jacked. He's a 70-year-old, but he had the build of solid muscle. He worked out. He was a Marine. He would get up at 4 o'clock in the morning and work out. He was finishing his workout as we would show up at 5 o'clock in the morning for training.
That's awesome.
And I'll never forget the lesson that he taught me at that moment. He said, "Look around this room. All these guys, they're going to continue to eat the way they've eaten, and they're going to stop training. Don't do that. Always keep moving. That's the secret." And that stuck with me. And so I work out 7 days a week, not intense all 7 days, but I'm doing something 7 days a week. And I think having rituals, so knowing what you're going to do. So for me, when I wake up first thing in the morning, it's kind of become cliche now, but I feel like it starts my day off well. The first thing I do when I roll out of bed, I walk in, I jump in a cold plunge, and I sit there for 2 to 3 minutes. And what I've noticed from that is I feel like it calms me down. It gives me clarity. It's a great start to my day. And I feel like that's a healthy habit that I've implemented over the last probably 18 months. And I notice when I don't do it.
Yeah, I bet.
I feel like when I do it, it kind of resets my nervous system and it gives me a sense of calm all day.
All right, so that's something I've wanted to start doing. How do you do it? Do you have something set up that it keeps it cold? Is it? I mean, tell me. You don't have to plug anybody. I don't mind if you do, but what's your system? How do you have it?
So I started this time of year. It was probably close to 2 years ago, actually. I went onto Amazon. I bought one of the cheap pod things that you set out on your back porch, and when it's cold outside, the water stays cold. I mean, there were times, especially last year, I'd go out and I'd have to have a hammer and break up the ice.
Really? And
I would get into it. And then as this last spring, as it started to warm up, I realized I'm going to have to figure out a way to do this during the summertime. And so I started looking into cold plunges, and they're super expensive.
Yeah, they are.
But I found a company in Austin that it looks somewhat like a chest freezer.
Oh, yeah.
That you'd store deer meat in or whatnot. And they had converted it into a cooler. It's got a cooling unit, and it's got a sanitation unit, and it's wrapped in wood, so it looks pretty cool.
Okay.
And I just lift the lid, jump in, and it keeps the water cold. It'll go down to 35 degrees. I keep it at about 41 though for me.
That's
and it was half the price of the big name brands that you see out there, and it's been awesome.
It's something that I've done, and when I do it, I'm glad I did it. The rush that you get when you get out of that cold plunge is incredible.
It's awesome.
So, but I've always struggled with the logistics of it. It's like we live out in the country. I thought about just buying a trough, like a horse trough.
That's a great way.
But then how do you keep it cold in the summertime? So I was like, well, we could stock bags of ice, but it's like, man, that's a lot. I better just go buy something.
The one thing I found about healthy habits is they need to be simple.
Yes.
And they need to be easily repeatable.
Yeah.
And so the ice bag, you got to go to the store, you got to store them, you got to pull them out every time.
Yeah.
If I had to do that in the mornings, I wouldn't do it.
Right.
I need to be able to get out of bed and just get in it.
Jump in.
So I highly encourage it. I found it super helpful for me.
I'll get the brand name from you after
Yeah,
this,
absolutely.
I'm interested. My wife is too. You mentioned football and playing college football. Abilene guys. I grew up in Abilene. You played at Hardin-Simmons. I got a couple Abilene questions for you.
Okay, let's try it.
Let's stick with football first. Your favorite football story. I love these stories, by the way, because there's something about sports, something about athletics that brings us together. So, favorite football story.
I had never heard of Hardin-Simmons or Abilene. I grew up outside of Southwest Houston. I went and toured the campus, decided to go to school there and play football. And I thought, being one of the better football players on my team, one of the best kids on the team, I'm just going to walk in. It's Division III. How competitive could this actually be? And I will never forget. I actually have kind of forgotten because of what happened. Early on, I'm a scout team guy because I'm a brand new freshman. It's the start of the season, and I'm on defense, but I'm running a scout team offense.
Yeah.
And they call this play, and I'm going to run out, and I'm going to block our safety. And I'm thinking to myself, the entire team's watching. I'm about to make a name for myself because at this point, I'm like 230 pounds, and the safety's about 175 pounds. And I think to myself, I'm going to kill this guy in front of everybody. Everybody's going to know my name. And we run the play. I run out, and I see, and you know this, you're coming out to block, and the safety and I lock eyes. And I'm like, oh, this guy wants some. I'm about to give it to you, buddy. And I lay into this guy, and he literally, it's on video somewhere because we videoed our practices. He hit me so hard. I've never been hit so hard in my entire life. He cold knocked me out, unconscious.
No way.
Unconscious. I got a concussion. I don't remember that day. I don't remember getting up off the ground. I don't remember going into the locker room. I don't remember anything. The guy straight up knocked me out.
Welcome to football.
Welcome to football, but it taught me something. One, you better check your ego out the door. You think you're good? There's always somebody out there that's better than you. Be humble about it. Work hard, but don't underestimate somebody.
Yep.
You can never underestimate anybody. And that guy, he taught me the lesson the hard way. And I took that and thought, okay, I better figure out my place here. I'm going to have to work at this because these guys can play.
Yeah.
It doesn't matter what level you're at. All those kids were all state, all region, all something. They were the best kids in their football teams in high school. Doesn't matter what level you're at. People want to compete.
Yep.
And they will.
Yep. I coached at that level, and people don't understand. Parents definitely don't understand. If they're a little kid who's pretty good, he's starting on a pretty good team in high school, they think they can just go play D3. Yeah. You haven't seen D3.
You better buckle your chin strap tight because there's some kids that can play.
Yeah, they can. And a lot of those guys come from D2, D1. They transfer down, and they've got all the talent in the world. So, but don't judge a book by its cover. That's something in sports. I mean, to this day, I'm a basketball guy. You go to a YMCA, the guy with the goggles on, the guy with the knee brace on, that's the guy that'll kick your butt. Yeah. I mean, he's going to bust you if you don't guard him. So, all right, best Abilene restaurant.
Ooh. So it's been a while since I've been to Abilene, but when I was in college, there was a catfish joint. I think it was Catfish Corner.
Catfish Corner. Yeah.
Every Tuesday night, they had all-you-can-eat catfish, fried catfish. And so the football team would go there and just dominate that place.
They lost money that night.
They lost money that night, but they always welcomed us because they knew we were coming every Tuesday night. Yeah. Barbecue Harold's, right by Hardin Simmons, has a great barbecue spot.
No doubt.
I didn't frequent this place very much, but Perini's Steakhouse up in Buffalo Gap.
Legendary.
Legendary. In fact, from what I understand, George W. used to have, when he was in the White House, used to have their steaks flown in.
Yeah.
But I'd been there a couple times, and phenomenal.
Oh, it's incredible.
Phenomenal. It's an experience when you go out there.
Expensive, too.
Yeah, but you see,
especially on a college budget, I bet.
You show up on a ranch, and you see the cattle that they raise. It's all, you talk about farm to table, that's what it is.
It's incredible.
Yeah.
Probably the best steak I've had. And, I mean, I grew up in Abilene. My family's been there for 30 years. I think we've been to Perini's probably 4 times in those 30 years, but it's so good. And, for all those Abilene listeners out there, I know there's like 4 of you. Go to Catfish Corner, which I agree. It's awesome. Harold's, he passed like during COVID.
Oh, I didn't know that.
But still going. I think his son runs it now. Still good spot. And then on your anniversary, on your graduation night, whatever it is, special occasion, go to Perini's. Best food you'll have anywhere. As I've gotten to know you, this is what I've noticed. You've got an incredible passion for our industry, a passion for creating. You're enthusiastic on educating. Where does this passion come from?
I'm a competitive person. I like to win. I like to see other people win. But if I really kind of think back to the origin of where it came from and kind of how it ties into our industry today, I'm thinking about when I was in middle school going into high school, I was bullied. And there was a group of guys that just constantly picked on me, wanted to fight, that sort of thing. And it just got to a point one day. I remember walking, I'll never forget this day, I'm walking from school going into the field house for football practice, and they're pushing me, goading me, just bullying me.
Yeah.
And I turned around and I realized I'm going to have to stand up. And I punched Joe Garcia. Joe, if you're out there,
I'll do it again.
Joe, this it changed my life.
Yeah.
And we tied it on. And what it changed everything that day because the bullying stopped.
Yep.
And I found a power in being willing to stand up for myself. And when I look in our industry today, that's what we're fighting is bullying. There's very powerful interests, very powerful entities and people that are bullying our society. I kind of view my role as somebody that stands up and gives a voice to people that don't have a voice. And the people that don't have a voice are all of us in this room, in all of these buildings. As you look around, there's employees that are being bullied by the system.
Yep.
And somebody has to stand up for what's right. And the better way to do this, because it's taking their resources, their money that they spend on health insurance and when they get health care, and that money is no longer going into their 401k for their retirement. It's not going into the new house or the vacation or the kids' college education. It's literally stealing the American dream from our society, and it's enriching others who are bullying our economy. It's taking resources from our economy, and there's a better way to do these things. And for those that are willing to stand up and say enough, those are the people that we're helping to do that and create value in their businesses, create value for their employees, putting money back in everybody's pocket instead of just giving it to somebody who's basically demands and sets prices and says, this is the way we're going to do it or else.
Yep.
And for anybody that's looking to stand up and take that sort of stand and create value, that's the opportunity. And that just kind of tying it all full circle. I never thought about that before, but that's really where it comes from. It's standing up.
It makes perfect sense. And I saw something just the other day. I'm glad I saw it because it ties into what you said. The average family pays about $24,000 a year just to have access to paying a deductible.
That's right.
Just to have access to paying a copay for their health insurance. That is $24,000 for the average family. And I'm a family of 6, so we're probably above average in terms of size and spend. It's an incredible burden financially.
Think about the average American worker. If they make $50,000 or $60,000 a year, to pay $24,000.
Exactly.
If you're with a big mid-market company, maybe you pay $20,000, but then you've got a $3,000 or a $5,000 deductible. By the time you having a baby or getting a surgery or your kidneys or tonsils out, you've spent $25,000 to $30,000 a year. That's half of your pay. Who can afford that?
Yep.
And so it's solving that particular problem. And people look at healthcare and they think, wow, it's 20% of our GDP. It's 17 or 18 trillion dollars. How are you going to solve that problem? And I'm sure we'll get into this about the differences between single payer and private insurance, but you're not going to solve it at the national level. The way you're going to create value and solve the problem is by grassroots, where companies say, we're not going to do what we've always done. We're going to challenge the status quo. And it's creating another $500,000, $1 million, $3 million in individual companies that can then lower premiums for their employees. They've got cash flow now that they can reinvest into their business and spur economic growth. So I always ask the question is, putting your money into healthcare and continuing to pay these entities that don't have your interests at heart, is that going to boost our economy, or is it putting money back into entrepreneurs and business owners' hands to help their employees and help their business at the same time? Which one is going to create more economic stimulus? And that's the way I look at the problem. So today it's one company, and then tomorrow it's 2. But as companies in our local economy start doing this, it creates economic growth.
100%.
And seeing that expand around our country today, I think it's one of the fastest growing areas of our industry. It's exciting to me because there are other advisors just like me that are standing up and saying, we can actually solve this problem.
Yeah.
And the more that adopt, it spreads. And we're at a tipping point now, in my opinion.
Well, I think that's how movements happen, right? Mm-hmm. It's not when you start at the top. It's when you start with the individual and with the company, and you can impact 100 lives at a time. And then just like recruiting in college football or college sports, they tell their friend who tells their friend. That's and right. Now it's starting to spread, and we can regain some power. We can regain some leverage, put some money back in our pocket, and here's the thing that people often associate with this is, well, it decreases my access to care, it decreases my experience while getting that care. No, it doesn't. It doesn't have to. Mm-hmm. And I think that's a common misconception that employers have to understand is we're not going to reduce the experience and the outcomes or access of your employees to the care that they need. We're just going to make sure that it's the right quality and it's the right price.
That's right. And oftentimes if it's done right, you can increase the access to care because you're able to provide access to physicians that employees don't have access to today. It's a different level of care. Yep. Or you're able to provide them additional benefits that provide. And oftentimes people don't realize this, but if you go in, and I use myself as an example, I needed a hip replacement because of my football days. People don't know what that costs. And what they understand is, it's my deductible out of pocket. It's $5,000. But if you look at the 2 hospital systems across the street from each other, one of them is $60,000 for that procedure. The other is $20,000. How do we make sure, and the 20 oftentimes is better quality.
Yeah, it is.
How do we ensure that employee is willing to go in there and get it at the right price at the right place? And so if you design your plan, you're actually increasing access, but the benefit to employees oftentimes, the way we design our plans is if they're willing to go to the right place, you just make it free for them. They no longer have their deductible out of pocket. So you think about your family, whereas in a traditional plan, you're going to spend $5,000. You get to keep that $5,000.
Yeah.
I just put $5,000 back in your pocket, and your company just say $40,000. That was my exact example. And I got to see the surgeon, and I went to the hospital that I wanted to go to, and I paid $0 for it. So what bigger win-win can you get? My plan saved $40,000, and I got to keep my $5,000 out of pocket.
Saves everybody money.
Yeah, and the amazing thing is you can do that with just about anything that's inside of your health plan. I wasn't forced to go through that channel. I had the option.
Yeah.
So we're empowering employees. Make a choice. You can go wherever you want, but if you're willing to go to these certain providers and certain places and you source your medication this way through this mail order pharmacy or whatnot, like Mark Cuban is a good example.
Yeah.
It's free.
Well, and that's the thing. I mean, if we were to behave as patients in healthcare like we behave in any other consumer environment, if we had those options, right, to be that consumer and intelligently shop for our healthcare, it's amazing the quality and the cost savings that we could realize.
Yeah, and you think about just the average American. They know more about their iPhone, the difference between an iPhone 14 and a 16, the camera and the processor, and they know the price of it. You buy television, you can go on Amazon and you can read reviews, and you can go to Target or Best Buy or where, if that place even exists anymore. But people,
it does.
They have a way to shop for quality. They have a way to shop for price. They've got different ways to pay for it. I can put on a payment plan, use my credit card, pay cash, what have you. And that's like shopping for eggs and comparing the price of eggs. Do I buy the 12 pack, the dozen, or the 18? Do I get the name brand or not? It's like 2 cents different per egg.
Yep.
Oh, that's great. You saved 2 cents per egg, but you just spent $40,000 more than you should for this other thing. Like, let's focus on the things that matter. Right?
I'm laughing because it sounds like common sense, but it's an innovative way to look at healthcare, because we haven't challenged the status quo in this area very much in this industry. And so as you talk about it, especially people that have been in this industry for a while, it makes perfect sense. But a lot of times patients, employees, employers don't even know that that's an option. There are other ways that you personally and Hotchkiss have challenged the status quo and worked and improved through innovation. What are some ways that you personally are differentiating from other brokers and consultants, but also how is Hotchkiss doing it at a larger level?
Yeah, that's a great question. I think, so I've been in the industry for 10 years. I got into the business after spending 15 years in corporate finance and banking. And I actually had experiences with clients, one of which was a large national brokerage. They were a client of mine. I helped raise capital for them to acquire firms like ours around the country. So I saw how they made money at scale on the brokerage side, but I didn't really understand how the advice they gave, how they actually monetized clients. And so once I started digging into that, I realized, wait a minute, it looks like maybe there's some conflicts of interest. We're trying to aggregate with carriers and we're taking big bonuses from them, which is great financially for the brokerages. But I thought to myself, does that create a conflict of interest? Who's their actual client? Is it the carriers or is it the clients? And so I started asking my clients at the time, big companies, how do you manage the cost of healthcare in your business? Because I have their financial statements. I'm looking at them. I see it's a very large line item. And if you're listening to this, and you run a manufacturing business, it's typically the third largest expense on your P&L behind the materials, labor, healthcare.
Yep.
And if you run a service business, it's usually the second largest item in your P&L behind labor, your salaries. And the responses I got were really interesting. It was like, well, there's not really a way to manage this. It's whatever our broker gets from the carrier. And we'd budget a 10% increase per year. If we come in below, we're happy. And if it's above, it's like, oh, well, we just have to figure out how to manage that. We'll pass costs on to the employees. I thought to myself, that doesn't seem right to me, because some of these companies, names you'd know, they manufacture products that everybody has in their house. The CFO could tell me what his plastic input costs were going to be 2 to 3 years out, because they hedge those. They had these sophisticated ways of managing costs. And I thought to myself, we're not addressing the real cost driver. The real cost driver of your insurance is the claims that you pay. It's what are they paying out for your health care?
Yep.
That's where we should really focus versus saying we're going to get this carrier to compete against this carrier on their profit margin, because they're not. Do they even have the same interest that you do in lowering health insurance costs? And what I realized very quickly, the carriers, traditional carriers, they don't have the incentive to lower healthcare costs. They actually want them to go up. If you look at the way the ACA is designed, which, by the way, they help write, their profit margins are capped at 15% in aggregate of the premium they take in, because they have to pay 85 cents out of every dollar they take for healthcare costs. So just right out of the gate, if you're the CFO and the CEO of a big publicly traded insurance company and you've got to return shareholder value, Do you want 15% of $1 million in premium or 15% of a quadrillion? And so their whole goal right out of the gate is how do we justify spiraling costs up so we can take 15% of a growing pie?
Yeah.
And when you look at the innovation that they've inserted into their business, when I say innovation, just from a business strategy standpoint,
Right.
they've vertically integrated. So there's a lot of talk about pharmacy benefit management and pharmaceuticals and in our, especially with the election going on right now, and
Yep.
rebates are bad and we need to hold the drug manufacturers accountable. But when you look at what's really driving the pricing of these drugs, and for commercial plans, it's how the PBM contracts for those medications. And not to get too complicated, but if you look at how the carriers make money, they profit from those expensive drugs going through the plan. They show back up with the broker and to the employer and say, your claims utilization is high, therefore we have to raise your premium. But when you look at what they're actually paying for, they're going out and buying, they're paying sometimes 2-3 times what they should be paying for the drug. They're taking that money, stick it in the back pocket, and then they show you an increase because their costs were high. Well, whose best interest is that in? And so there's in the economy today, in our industry, the talk track around vertical integration is we're creating value for our policyholders. But if that's actually true, you would think I should see premiums coming down.
Right.
But you don't. You see premiums going up.
Yep.
The value is being captured for their shareholders. And if you look back at their stock performance over the last 10 years, you can see where the value is going. It's going to shareholders. It's going to the CEO. And so they are capturing a ton of value. It's just not being passed on to companies and the employees. And so the mindset that we have behind the plans that we design is how do we break up those misaligned incentives and return the value that's created in a health plan back to the employer?
Yep.
And they're very simple, common sense strategies. When we sit down with an owner who's typically an entrepreneur, the CFO and the HR leadership, and we say, these are the basic things that you can do to return value back to your company and the employees and bring your costs down and create stability. Usually it's like a light bulb goes off and they're like, that makes total common sense. Like, why doesn't everybody do that?
Yep. Well, because it hasn't been an option. People, or if it has been an option, people haven't been aware of it. Nobody has been, and this is a big shift that I've seen in your area of the industry, is there's been a focus on education in the last 3-4 years that hasn't been there traditionally. And when you think about an entrepreneur, when you think about an owner, a founder, a CEO, they're usually so deep in their business that they don't have the time or the mind space to really focus on this. And healthcare is confusing. So they've trusted, these brokers traditionally to give them the information that they need. Where I've seen people like yourself, people like Spencer Smith, it's like, listen, we're gonna share with you what we've learned over time so that you can focus on your business, but also run it effectively and as innovatively with the kind of innovation that you do in the other areas of your business. Let's apply that same logic and ideas to your healthcare.
Yeah, that's absolutely right. And the couple things I'd leave you with is the innovation that we're using today is not new. There's a book out there called I might butcher the title, but you'll find it. The company that fixed healthcare. And I read this book, and it was written by an owner of a mid-market company. He has about 1,000 employees. He's in, I believe, Wisconsin. He's a manufacturer of parts for the auto industry. So he's squeezed because the manufacturers want lower price. His healthcare costs continue to rise. It was cutting into his margin. He writes in the book that it threatened the existence of his company. Okay. And he lays out a common sense strategy of how they actually lowered their costs, provided better benefits to their employees. And it's a very similar plan that what we use with our clients with some slight differences. And I thought to myself, how old is this book? And I flipped back, and the book was written in 2009, before the ACA. Think about that for a second. 2009, before the ecosystem that we've got
Completely
today.
Changed. Yeah.
So the concepts are not new. So the question becomes, why isn't that spreading? And I think it goes back to the way, I'll tie this back into what I think is a differentiator for us, me getting into the industry after the ACA was passed. I believe the people that we trust, the brokerage community, the advisory community, to help us be the knowledge expert. If you look at the interests of the brokers, particularly the ones that are really large and have been around for a very long time, they've got these legacy books of business with a big carrier or a couple of big carriers. if you go back and do the same exercise when you look up the carrier's performance, stock performance over the last decade, look at the brokerage community. Just pull up the top 10 and look up their stock ticker. It tracks very similarly. I've got 2 graphs I can share that just overlays the carrier performance and the brokerage industry performance to the S&P 500. And oftentimes it's 3, 4, 5 times the S&P. And what I see, just from my knowledge of having worked with those companies and in the industry, the carriers pay big bonuses and pay high comp to brokerages to keep the system working the way that it is. I go back to, where are there conflicts of interest and misaligned incentives? You need to solve for those and make sure you're getting the right advice. The people that you trust to give you the information you need to make the right decision is critically important.
Yep.
And so even taking that a step further, lobbying money that's spent in Washington is public information.
Yep.
You can see it. And the healthcare lobby spends 3 times what second place, which is electronics manufacturing. Just in year-to-date 2024, just year-to-date, $374 billion has been spent by healthcare. That's the hospital lobby, the insurance lobby, the pharma lobby. And it's all the big names that we know, we see on TV, on billboards.
Yep.
$374 billion. I'm sorry, $374 million versus $125 million spent by the electronics manufacturing industry. In fact, healthcare is larger. It's 2.5 times larger than oil and gas and defense combined.
And think about how sensitive a topic, those things are, how people get riled up about, big oil and all these things. 2.5 times that is where the healthcare spend is.
Over the last 10 years, it's $6 billion in aggregate that healthcare has spent lobbying in Washington. And for that kind of money and that kind of time, if somebody was lobbying for change, the question I asked, wouldn't we have something?
Right.
But in fact, if you just look at what's happening, they're lobbying for more of the same.
Yeah.
Don't change our industry. Don't make us post our prices. Don't make us compete. Let us continue making money off of this vertical integration.
Yep.
Keep it the same because we're all making money and we're going to pass it back to you. So everybody's getting paid to keep the music playing.
And the patients often get left out of it because we're the cash cow. We're the engine.
Look at these people in these cars driving by. We don't know them. They're nameless. They're faceless. It's just money. It's just money. We're not doing anything bad. We're providing health care. And I hate to be cynical about it in that regard, but that's the experience and all the experience and the knowledge that I've been able to uncover being in this industry. That's what I truly, truly believe is happening. I don't think they're bad people. The job of a CEO and a CFO is to maximize shareholder value.
And that's the thing. It's like it's an incredible business model. Mm-hmm. The returns on investment are pretty impressive. So if you just look at it from a business strategy perspective, it's like a case study, something we could all learn from.
Yeah.
But it's different because of, first of all, the industry, but we're all patients. And man, as expensive as everything is in this world right now, we need a little bit of a break. And if we don't, the stress that the patient, the people, the population put on the health system is just going to grow, which then gives them more power, more leverage. That's exactly why I asked that healthy habit question at the beginning of every podcast, because we have to control what we can control. We have to maintain and improve our own health, because if we rely on somebody else to do it, that's not necessarily what their focus is. You've talked about misaligned incentives. You've talked about this information and the stuff being publicly available. And oftentimes during these conversations I hear, well, we need transparency. We need transparency. We need transparency. But I don't even know what transparency means. Like, what does that mean? What does an employer need to be demanding in terms of transparency? What does transparency look like?
Yeah, so I'll go back to just the consumer experience. I want to buy a television. Where do I go? Usually for me, the first place I'm going to go is Amazon.
Yeah.
I'm going to put in what I need, what I'm looking for. I'm going to read reviews. I'm going to look at prices. So oftentimes healthcare gets overcomplicated. And the more complicated we make it, the more we entrust others to help us make that decision.
Yep.
And so really for me, transparency is, how do I give information to somebody to where they're able to buy something the way they do anything else in their life? So instead of bickering over which eggs I buy because I can save 2 cents, wouldn't it make more sense to put something in a consumer's hand where they can save thousands and thousands of dollars? The employer can save thousands and thousands of dollars. So I think transparency comes from a couple of different places. One, it starts with data.
Yeah.
Most companies don't know what they spend money on, where they're spending it, or even if it's a good price. So being able to get access to your data, when you get the data, you can line item by line item, just like we do everything else in our lives and business. I'm buying these things. This is what it cost. The first question you have to ask is that a good price? Am I paying the right price for this? Am I spending $10,000? If you think about plasma TVs when they first came out, that technology doesn't even exist anymore. But the first TVs that came out were like $10,000.
Yep.
I could buy better technology now for $200 at Target.
That's true.
So it's looking at what we're buying. Are we paying a fair price? That's the first place that we start with transparency. The second place is, how do you take that information and put it into a digestible form that's easy for an employee to pull it up on their phone, or even, we do a lot of work with blue collar, kind of the full spectrum. But I'm thinking about folks maybe that don't have easy access to technology. Do they have a resource that can help them? Because if you think about a healthcare journey, I'm diagnosed with cancer, super scary. What am I going to do? Where do I go? My doctor's telling me these are the things I need to do, but I need a second opinion. I need to know, where do I need to go? And giving the employee an outlet that's unbiased, that has access to all of the information, that's able to say, here's the steps in the process, here's where you should be going. We're going to take care of it for you. And it's going to be more cost effective for the employee. They're going to get a better outcome, and it's more cost effective for the employer.
Right.
So really, to me, transparency is, how do we give information that's easy for people to access and use and make actionable decisions? Because
data is just data unless you can learn something from it. And so, oftentimes, like you said, healthcare can be complicated, and it's complicated probably for a reason that is darker than we want it to be. And so having somebody to bounce this information off of, to get a better perspective of what it actually means so that we can make good decisions is valuable. And I think that's where roles like yours come in very, very handy and important to, making this change and starting to challenge the status quo. Brings me to my next question, which is margin and mission. Businesses they're stuck, traditionally they've been stuck. This paradox is, I've got to make margin. I've got to build and grow a business, but I also need to offer great benefits to my employees. And oftentimes those are opposing ideals.
Yeah.
And so how can, and from our conversation today, I can already anticipate your answer, but how do employers need to start thinking about delivering both? Achieving margin, but offering great benefits to their employees?
Yeah, that's a great question. When I got into the industry 10 years ago, I came into the industry from the mindset of, my mission was to help companies reduce their cost, improve their profitability, and create more value for their companies. So a lot of the businesses that we work with are privately owned. They're not publicly traded. But the owner is acutely aware of the value of their business because it's a multiple of their cash flow and their earnings. And so when I would meet with owners and CFOs, look at this structure. I'm going to be able to reduce the cost $500,000 or $1 million. And if you trade at a 5x multiple, I just put $2.5 to $5 million of value to your company.
Yeah.
And that was super attractive to a lot of the owners and CFOs I was working with at the time. But what I've realized since is, I'll call it a dual mission. The very first client that I had right down the street, when we met with the employees, so we talked about nameless, faceless people. You're in a publicly traded company in New York or somewhere. You don't see the people that are impacted by your decisions. I saw firsthand the employees that were affected by the status quo system. My very first client I picked up was in a traditional, fully insured plan. They got a 20% increase. I'm meeting with the employees to explain their benefits. And a mother walked up to me after. She was a single mom, tears in her eyes. And she said to me, the only plan I can afford is this $6,000 high deductible plan with an HSA. My son needs to have a procedure on his ear, and they're telling me that the procedure is like $20 some odd thousand. What do I what is my cost going to be? And it's like, well, it's going to be $6,000. It's the deductible.
Yep.
And she started crying and she said, I don't have the money to pay for that procedure, but this is the only plan I can afford. And it was that moment that I realized my mission is trying to help these companies save money. We need to design something that helps people, that helps the people. And so I view when I walk into I see all my clients, I go into their operations and I look around and I see people that are like my brother, my mom, my wife, my family, because they are.
Yep.
They're somebody's brother or father. And they don't have the ability, if somebody's not going to be willing to help them solve this problem from themselves, who else is?
Yep.
And so what I thought was my mission was to help companies create value and increase cash flow in their valuation. What I realized is the real mission is, how can I help their employees? How can I help somebody's brother or uncle?
Yeah.
And that's really what drives me, because I know that I'm creating value for them.
Well, we started this conversation talking about bullies, and some of our callings is to stand up for those who can't stand up for themselves. And these employers are being bullied, but in reality, it's the employee that takes the brunt oftentimes. And so that's part of your mission. This dual mission is, yes, deliver value to the company, but stand up for those who can't stand up for themselves.
That's right.
We've got an important, political event coming up in
What's
about
that?
20 days. It's this election that you may have heard of. With every election year, trends, opportunities, challenges are on the horizon. What do you see as something that might present itself 2025 and beyond? How are we preparing for what might be coming down with some of the political changes we could experience?
Yeah, that's a really big question. One camp is more geared towards, and we've heard this over the last several election cycles, and it's been attempted, but single payer Medicare for all, where the government's going to take complete control of our health insurance system and take care of us all for free. It sounds great. And then, so that's one camp. The other is free market. And anybody that's listening to this, probably half of them are like, well, we've already tried the free market. That doesn't work. Capitalism in healthcare does not work. And what I would challenge that statement with is, do we really have free economy working? We don't. It's an oligopoly. You've got four big payers, which they're not even the payers, by the way. The insurance companies are taking your money and then squandering it and skimming off. They're bookies is what they are. Like, hedge our bets, skim the profits. Costs are up high, we're going to get it back from the employers. It's not even their money. It doesn't matter how your health insurance is funded. You're paying the cost, whether you're paying it in a fully insured premium, a self-insured premium, you're paying for it. Who's managing it for you? So in that regard, it's not truly free market. But what you're seeing as a biggest trend that we see right now is a lot of the plans and strategies that we're using. You mentioned it earlier, people tell their friends. An owner is an YPO, Young Presidents Organization, or you've got a CFO that's in a CFO roundtable. My clients call me and tell me, hey, healthcare is coming up. HR roundtables, the healthcare is coming up. Companies are figuring out how to grapple with this. They can't figure it out, and they're introducing me to their peers. And that is happening all around the country, and you're seeing this strategy that we're using taking off like wildfire. It's a grassroots movement, and people have said, we're not going to wait for the government to solve this for us. There are things that we can do now to take back control, and we're doing it. And so I think you're seeing it now, and it's accelerating. So really the question is going to be are we going to move into a government-run system, or are we going to continue on this grassroots movement where companies stand up and say, enough, we're not doing it your way anymore. We're going to do it a new way. And the reason why I like working with privately owned companies is, if you think about, I always love to hear the origin story of the business and how the risk they took. Usually somebody went and worked for a big company and they thought, you know what, I see this niche here. I'm going to take a risk and I'm going to go out and start my own company.
Right.
Whether that's the first generation or second generation in that business. But it's that entrepreneurial spirit that they took to start their business and build up something that's successful. And really what I'm teaching these employers is, take that same innovative entrepreneurial spirit and let's put that into this business unit that you have. Because
it's your second or third biggest line item.
Make no mistake, if you are an employer and you have you offer health insurance, you're running a healthcare division. If you just look at what you spend for it, it's a division of your company.
Yep.
Yet one of the most expensive things on our P&L, we turn the keys over to somebody else to manage. Now, the companies don't have to manage it. That's what they hire a good advisor for, to build the system.
Right.
Looks and feels very similar to what they've got today. They're not paying claims. You got an insurance group that's handling all that for you. But it's just building a different model.
Yep.
And it's taking that same entrepreneurial spirit and fixing something that's broken in their business.
Well said. Last thing, one thing, if anybody listening and watching, if they could go home and share it with their family, or if an employer could share it with his director of HR, whatever, what's the one thing you want our listeners walking away understanding?
So I mentioned the company that fixed healthcare. This is not new. This has been around. It's been tried and tested for over a decade, 15 years. I think people should be curious. People need to ask the right questions and ask why. A couple of questions people need to ask. Why are my costs going up? What can I do about it? And who's the best group to help me solve that?
Yeah.
I think you gotta have to be willing to challenge what you're being told. It's a contrarian viewpoint. And the companies that take that mindset and are willing to have that curiosity and challenge it often end up with a better result.
That's how the best businesses are built. Let's apply it to healthcare.
Somebody told Elon Musk that you're not going to be able to send a rocket into space. The government's the best one to do that, NASA. Quick story, my grandfather was a physicist for NASA. He worked on the Apollo missions. He worked on all the space shuttle missions. And I'll never forget this. In the late 90s, before he passed, he told me, Chris, private space flight is where this country needs to move. And I was appalled. I was like, Grandpa, there's no way. It's
NASA guy.
NASA. How is this possible? And he said, private industry is going to be able to do this better than the government. You watch. One day, there's going to be somebody that's going to be sending rockets and shuttles into space, and it won't be NASA. And he was way ahead of his time, because fast forward 20 some odd years, it's Jeff Bezos and Elon Musk that were willing to say, I think there's a better way to do this. Think about this. We used to just destroy rockets and boosters, and rockets were not reusable.
Right.
Somebody challenged that and said, well, why not? Is there a way to do that? And can we bring innovation? And we're going to challenge the status quo, and we're going to get that done. And that's a new frontier for us. And that's possible with just about anything in life.
Yep.
If you're willing to find the right people that will ask the right questions and challenge the assumptions. This is what we've been told. If you've ever been to a circus, you'll see they tie elephants up with a stake in the ground. And I always ask, that's crazy. That stake is not going to hold that elephant. How are they getting away with that? Because they do it to baby elephants, because that baby elephant's not able to pull the stake out of the ground, and it learns, I'm just not going to challenge the stake. Challenge the stake in the ground.
It's a mindset. You don't know what you're capable of. Healthcare is complicated. I don't know if it's rocket science.
It's not rocket science. It's common sense.
If we can disrupt rocket science and bring common sense and challenge those assumptions, the same can be done in our industry. And I appreciate you sharing a couple ways we can get started.
Sure. My pleasure. I appreciate you having me.
Welcome back anytime.
Awesome. Thank you.